So the entrance for registry is gonna come through here. This is our main entrance, and the main reason why you gotta come through here so the security can process you. Security is right through there. The parking for registry for knock shift, you can park through here, which is our admin parking lot. Otherwise, across the street in the morning, if you're coming in PM or AM shift, there's another facility. It's called Silverado, and there over to your left over here, there's going to be a shared parking lot. You park through there, and then you come in through here. You will be greeted by our security guards, and you have to step back as soon as you knock through this door. You have to step back, allow the doors to open. Security guards will process you, and we're a multi-tiered facility. So we have assisted living, independent, skilled nursing. When you're coming in, just make sure you're telling them that you are working in skilled nursing. Okay, if you are a nurse, here are things that we really require, and we really take this as a serious issue, because if you miss your charting, it affects the next shift. For example, if you don't do any of your treatment or monitor, if you miss your blood pressure when you're giving your medication, it affects the next nurse that's coming in after you. So I'm going to go over some of the things that you really need to do and complete as a registry nurse. Make sure we're completing this, and if the charting is significant enough, we will take significant actions at the first incident. Because as a nurse coming in, a registry nurse coming in, we really expect you guys to know these things. These are just given. These are giving things in terms of charting. Okay, when you're doing electronic charting, there's gonna be for medication. There's also one for treatment. There's one for monitor. So before you go home, if you're looking at your EMR, you're gonna be able to see this. You're gonna be able to see medication. So if you have anything here that this one says there's basically no color there, this one is green. That means that everything, there's something due but nothing is late. If it's yellow, that means you're missing something, like you gave a medication but you didn't put the blood pressure on there, or you gave Dulcolax but you didn't put a result on there. Also, if it's red, that means you have something that's late. If you click on this East medication, I'm going to zoom out a little bit because you have patients here. The nurses who's counting with you when you're coming in and you're giving a report, or when you're leaving your shift, they're being asked to see if you completed your charting. These nurses are gonna be asking you to complete before you go home. Okay, for example, this patient right here has a yellow mark on top. That's likely because somebody had missed something. Okay, it's either a blood pressure or a meal or a some form of result, like a pain med that wasn't put in. All the white ones are complete. All the blue ones right here, or green colored, are the ones that are due. Let's go ahead and give us an example here. Let's click on her. So right here, Dulcolax was given, it's yellow. So you're communicating this, or at least putting something on here. You can go to task, and you can associate the results right here. All right, and Lucy actually put something here. There was none. So you can put none here. A blood pressure that you missed because you gave a cardiac medication, you have to do those. You have to complete those. Okay, there are other things on here like meals. If a patient, this matrix will ask you how much meals did they eat, or how much given snacks. Okay, there's a question on there. You have to click off, and all you got to really do is associate it. There's an associate button, because your CNAs had already put in a data for it. And all you got to do, there's an associate button right here. Click this associate button, and it will associate data pertinent to that question. Before you go home, make sure you're completing your treatments. All of your treatments has to be done. We have a wound nurse, but they're not doing your treatment for you. You have to do these. You have anything that's stage 3, 4, or wound vac, your wound nurse might do it. But anything like a skin tear or monitor, you're responsible to do all that. Your monitor button. Okay, all these has to be done before you go home. Again, we will take significant actions for nurses registry that are going home without completing these. Make sure you're doing your charting. There's alert charting at the nursing station that tells you who you need to chart for. Their vitals should be indicated, and then your weekly summary has to be done. Okay, if there's an event that opens, obviously open an event, and there's also observations on here. Okay, if you're not familiar with Matrix, the resource nurse should be able to help you, should be able to give you a quick training on Matrix. As a CNA or an LVN, if you're coming in, this is the nursing station. You're coming through that west hall right there, and you're coming through here. First thing you would do is just grab this census right here. But it gives you this census here. You can circle your resident and get a report who you have. We have the west hall here, the south, and the east hall, and these are all your resident. It has a legend here. It kind of tells you what they're at, what they mean. The other thing you could do is you can look at the assignment for the day, as we spoke about. All these right here is where your vitals should be. If you're looking for who your vitals are, this is it right here. The other thing you can do is grab a radio right here and sign off on the radio. There's a sign off on the radio right here. That's a folder where you can sign off on the radio, keep track of the radio. The shower also, there's a shower list. You grab one of these shower paper here if you're giving showers to one of your residents, and you have one of your nurses on the floor sign off on it. Okay, there's also a registry book right here. So you sign off on this in terms of your 530s. So there's two places you can sign. This one, and also you need to sign off on the daily 530. So you'll have your name right here, and you'll have to sign off right here. It tells you your break time, but this is where you would sign off. The CNA assignment is complete with the run that they have, the number of resident, the room number, where you will be during the dining, during breakfast and lunch and dinner, who your showers are, right here. And then the ones that are highlighted, hospice. These are hospice patients. These showers are given by hospice, so you don't have to give them. Break times, make sure you're communicating what time you take your break. Our supply room here, all of our staff put in a code, and everything from to Foley catheter to lotion to. Okay, this is the West Hall, and our West Hall, some of which has the number 6, which is ESP, also has the exit. So as I mentioned before, every main exit has these fire alarms. Okay, the fire doors, these doors are 1 hour fireproof. Hallway, there is a fire extinguisher. Inside the fire extinguisher, there are these right here, which you can check the room. If the room is clear, there's no fire, you put this outside the door, you close the room, and it indicates that there is no fire in that room. So each one of these hallways, as I mentioned, should have a fire extinguisher every 75 feet or so. The GHC, or the Goldberg Healthcare Center, is right there, and the patios here. As you walk through these hallways, the break room is through here. There's also the physical therapy room, and there is a beauty salon right here where you can take all your residents. In this side, and HR is going to be here. Exit will be that way. There's extra locker rooms in here. You'll be able to use some of these locker rooms and bathrooms. This is the break room where you can put all your food here. In terms of if there's no extra rooms over in the locker room, you can go through here. There's nobody here right now, really early in the morning. There's coffee and tea here, but there's refrigerator and stuff like that in here. Is right here, so it's away from the unit, but there's extra locker rooms in here. If you do decide that you need a locker, if you bring a lock, make sure you remove your lock, as it will be cut off at the end of your shift if you don't take it out of there. There's also a female bathroom right over here. Emergency situational cases, there is an elopement alarm right here. If you see that this is going off, you can put these code 1938A. It'll turn that off. It's usually when the resident is coming out of this door and they are at risk for elopement. And so, okay, our main kitchen for the healthcare center, as I was showing you this in the other video, this would be where we prepare all the food. There is a fridge right here where you have applesauce and snacks and stuff for the residents. Typically there is an aide here, so if you need something, just ask one of the aides here. There is a hairnet that's required here. There's a fire extinguisher right here. And these are carts basically that we push around the unit to deliver food to our resident to keep it nice and warm. There is a juice bar right here as well. And then there is an ice machine right there. Okay, so if you need ice, make sure you're putting gloves on and putting a hairnet on, and also talking to any of the clerks that will be on here. One thing too here at Goldberg Healthcare Center is that we are all kosher here. We serve all kosher meals. And so each meals are usually indicated by a different color trays, but the aides should be able to help you with that, okay? Along with the silverware are specific to whatever food we're serving. Again, this is our independent dining room, and we have two dining rooms. We have a dependent and independent. This would be our independent dining room. That right there is a utility room for the electrical room, and this office right here is for MDS IP, and this would be my office. If you need something, it'll be right here. Wash your hands obviously, and this is a room here where you can do charting. There's an extra computer right there. Usually the admission nurse is there, and then the e-kits are all going to be in here. We have a cubic system right there, and the fire panel. Fire panel is right here. If there is a fire, this first two alarm right here will go off. You push this right here, will tell you where it's at and what kind of fire, and any other lights that's going off in here should you just malfunction on this panel. And let me show you the main panel. The main panel for the fire alarm is right here as a which is right here. Same thing, it works the same way. Okay, and this right here is the emergency preparedness storage. You'll have that disaster kit right there. If there's any events that deals with a disaster or a fire, we would have to grab this and take it with us. There is supplies on there for your patients when you do have to respond to emergency. Any residents that are on thickened liquids, they can have these cooler in their room with a thickened liquid. The most important thing about the emergency situational cases is that if you forget what needs to be done because you're confused as far as how to respond, we have this in the charting room. It's called the EOP, Emergency Operation Program. Any event that happens, fire, earthquake, it's all going to be in here. It's going to walk you through, and it's organized in an alphabetical manner. That's the nursing station right here. There's a shower room over there. That would be the South Hall. This break room, this pantry right here is for staff in terms of locker room only. This is for our full-time and part-time staff. And then there's coffee in here for staff to make, but this refrigerator is for residents only. Okay, you can get things in here like the Insure and MedPass if it's available, but family members bring their food, they can also put them here in the building. Crash cart, it's all in here. This is the hallway here where you have a oxygen room right here. You walk through this hallway, you are going to see another one of these ombudsman phone number along with a fire extinguisher. And this room right here is where your activities happen. Okay, so if you're going through this hallway here, this is where you can bring your residents. This is called the synagogue, and this is where they watch a movie, do their activities. And you go through this room. There is a copying room right there, so there's lights on, and there's a fire exit right over there, emergency exit at the very end of the hallway over here. Our main dining room has these folders on here that can help you out in terms of breakfast, how to serve, what the meals are. So go over that folder for dietary purposes. Also, if we're serving meals that day and the two options that we have is residents don't like, we have these meal alternatives as well. Most important thing about the South Hall, this is our Medicare hallway, new admissions. Fire extinguisher here, And then ombudsman phone number over there in the wall. This hallway is that it's split. It's two hall here, and there's only about 3 or 4 rooms in each side. But your dependent resident, this is where they go for dining room. Okay, a lot of them that can't eat on their own will have to be here, assisted here. As you walking through this hallway, it's difficult sometimes to see who's calling, but we have this little call light system here. So this is how we monitor to see who's calling. Each of these hallway has a main exit for emergency purposes. I forgot to mention, but the south hall also is your red hallways where your COVID or patients that are isolated for specific infection, specifically COVID. But if you see isolation card right here, and then why they're isolated, the airborne or contact or whatever. And here's another isolation card, and there's a little trash right there. Okay, this is your clean linens. So the extra closet for your linens is gonna be here, through here. Here at Seacrest, we don't have a shortage of linens. We don't hide linens. We just have it everywhere. So this would be an extra closet full of linens that if we run out of there, we call housekeeping and they'll bring us more. Okay, the Goldberg Healthcare Center has a back entrance for all of its staff. Registry staff are not to come here, but this would be the entrance in the back. We have parking right over here. I know it's a little dark right now, but the entrance. Also the smoking area. There's only one smoking area for all staff. That's including registry right here. Unfortunately, if you do have to come here and smoke, you'll have to either ask one of our employees or ask security kind of let you in here.